All right, we have our panel returning to the stage, and we'd like your questions now. Anyone coming down? All right, then I'm going to pose a question to the audience, and perhaps someone can answer this. How can the ADRC reach out and collaborate with nursing home social workers? What one suggestion would be valuable for you as a discharge team to have the ADRC do for you? Communicate. Can you expand on that for me? Communicate in which way?
I have sent 18 people. I've referred 18 people. Only one time the interviewer even let me know that they were in the facility.
Okay. So you have referred 18 residents based on MDS Section Q. You've sent an ADRC referral. And your concern is that only once have you received feedback regarding the disposition of your request? Is that what you're saying?
I've never received this position ever.
All right. Can we talk about that, panel? Can we talk about how we're building infrastructure and capability on that?
I think initially, when the referrals came in, we were referring to JFS and trying to get those to them as quickly as possible. So there was a kind of disconnect in not knowing exactly what everyone's expectations were. But earlier this month when we had the same session, we heard that from folks like yourself. And so we started implementing with JFS so that when the referral is sent to them, as Sharon stated earlier in her speech today, that they are notifying you all for the person who actually sends in the referral, and then once the assessment is done, they're also letting you know the outcome, provided you're allowing us to have your email address, which most of you have been allowing us to have that. Sure.
Did that answer your question? There's an improved process.
Partially, but I think that, it says here that when they come into the facility, that they should talk to the social worker or the person that recommended it. Nobody talks to me at all. I don't even know when the interviewer comes in. Usually I find out from the resident that somebody's coming in and interviewed them.
I don't know what facility you're with. I'd like to find out before the day is over. Typically the care managers, when we get the referral for support services, the care managers are asked to initiate contact with the person who made the referral. Usually that's by telephone, and because we want to make sure that you're aware that we're coming to the facility. If that's not happening, then I'd like to know about it, and so please let's talk before you leave today. Thank you.
A question down front.
I wanted to ask, as you're going through this process and communicating, I'm a social worker at a long-term care facility, so I had a patient who I referred. I received the transition assessment on this patient, and this actually just occurred a couple weeks ago, so I think it's this patient that I'm referring to, they discharged, but I was able to add this to their medical record, and I wanted to make sure that that's something that's appropriate to do, because this is just a new process, and I got this, and I figured, well, this is certainly relevant to the work I'm doing with them, and I wanted to put it on their chart, and I wanted to see if that's appropriate.
The question is, because of an improved process within the ADRC support services, the information has returned back to the skilled nursing facility, including a copy of the transition assessment. And the social worker at the facility would like to know, is it appropriate to include a copy of that transition assessment as part of the resident's medical record? And my answer would be yes. The transition assessment is something that is confidential, so it should be treated as part of a medical record, and it would be completely within the facility's ability to include it. Folks that have access to the medical record would include the state survey agency, and there's a HIPAA contract with them. A resident and family could request that medical record, and if there would be a legal proceeding, there could be a request for that medical record. But as a registered nurse and a contractor with Medicare, I can't see any reason why that transition assessment should not be part of the medical record. And taking it even one step beyond, that transition assessment should be really good information for us to use in our interdisciplinary IDC, interdisciplinary care planning meeting, to work together with the ADRC and with whatever transition team, Money Follows the Person, or the care transitions team within the state, to try to make sure that we understand what this transition assessment means and what steps the nursing home needs to take and what steps the agencies need to take in order to promote this community-based transfer, if that's possible. So that's a very good question, and I thank you for asking it. Another question.
As a hospital discharge planner, is there any way to delineate which is more appropriate for the patient, a referral to the Division of Aging versus the ADRC, or to both, or?
Very good question. The question comes from a hospital discharge planner. Where should she refer folks to who are ready for discharge? The Division of Aging or the ADRC?
I think as the ADRC, we're all encompassing. So the very first thing that you should be thinking is to call our 1-800-223-9074 number. Our call center staff that answer the calls, you can talk to them and they will help you to understand what options are available and whether it might be more appropriate to make a community service referral, or to, at that point in time, help you understand that maybe options counseling is the option that they need at this point. So they can help you walk through that if you're kind of indecisive as to where it might need to go. If a referral was made for CSP, what they're going to do is to go out and do a general assessment, and at that time they're going to try to get an entire picture. At that point, if the case manager who goes out to do the community service program assessment determines that this individual needs more of that one-on-one, they also can come back and make that options counseling referral to go out and do those kinds of one-on-one things to help and get an application filled out. But then you also have your case manager who's going to continue to follow with that client to get them into the waiver program or other kinds of things. Is that?
We have time for one more question. Yes.
I work in a long-term care facility, and I'm a social worker there. Is it fair to say that there are some residents who would really not qualify based on their physical needs for discharge to the community, even though they might want to do that?
That's a very good question. The question comes from a social worker in a skilled nursing facility here in Delaware. And she asks, are there some residents who maybe are not eligible or qualified or would not succeed in discharge despite their needs? And yes, it is on a case-by-case basis. And we're going to be going through the 4 items in MDS Section Q. We're going to walk through that process. But one of the questions is coded what the resident expects or desires to have happen to them. And then that cues you into whether or not a referral is needed for the ADRC. But what I would like to reiterate is it's always important for the nursing home staff not to make the decision whether the resident is capable of discharge or not. That is sent onward to the ADRC, and that's part of the Olmstead Act and our federal laws for Americans with physical disabilities, that the nursing home staff independently cannot make the determination whether the person is a candidate for discharge or not.
There are some barriers to discharge that some folks could have, but what we try to do is we have a nurse who looks at that, your facility staff work with us, and all together, we come up with the barriers and try to figure out how we can resolve those. How can we overcome and give them services in the community to overcome those barriers?